Hello, I'm Bernalillo County Commissioner Maggie Hart Stebbins, and welcome to today's edition of Conversations with the Commissioner. Bernalillo County is facing a true public health crisis, an epidemic of opioid and heroin abuse that is tearing families apart, draining public resources, and creating a new generation of addicts. Bernalillo County now has the #1 overdose rate of all counties in New Mexico. And New Mexico has the unwelcome distinction of having the #2 overdose rate in the entire United States. But Bernalillo County and our partners, we're fighting back by working to raise public awareness and create new treatment options. And I'm pleased to be joined today with our partners in this effort, U.S. Attorney for New Mexico, Damon Martinez, Jennifer Weiss-Burke, from Healing Addiction in our community and Director of Serenity Mesa, and Rodney McNeese from the University of New Mexico Health Sciences Center. I want to welcome you all and thank you for being here today.
Thank you.
Thank you.
Damon, can you tell us about the HOPE initiative?
As you're just saying, we're in an epidemic with heroin and prescription drugs. And we at the U.S. Attorney's Office have the realization that we can't prosecute our way out of this. In essence, there's a generation of New Mexicans that are at risk right now because of this epidemic. So what we have done is we have joined forces with the UNM Health, basically the medical school. And we're trying to take a comprehensive strategic look at this entire epidemic, all the way from when we train the doctors, the pharmacists, all the way through the prosecution. So HOPE is our program, our initiative that we're going forward with. It stands for Heroin, Opiate, Prevention, Education. It has 5 prongs. The first one is prevention and education. Second one is treatment. Third one is law enforcement. Fourth one is reentry. And the fifth one is strategic thinking. And so we're trying to take a comprehensive approach to fighting this epidemic.
Great. And as you know, Bernalillo County recently passed a new gross receipts tax that is dedicated to addressing addiction, untreated mental health issues, increasing access to behavioral health services. And so we're also looking to partner with you to strategize how do we best invest those resources. I'd now like to shift the conversation to my friend and colleague Jennifer Weiss-Burke, who's on the front lines, really the front lines of treatment in our community. Can you tell us about your work?
Yeah, absolutely. Thank you for having me. So I've been involved in advocacy and awareness for about going on 5 years. It'll be 5 years in April. And really it started with my son's addiction to prescription painkillers that led to heroin addiction, and then ultimately an overdose where he passed away 4 years ago. And advocacy and education I think is super important, and then I think treatment is another avenue that we have to spend a lot of time and resources in. And so we opened Serenity Mesa in May, and we've had a lot of help from the county, a lot of help from different partners trying to get this place up and running, because it takes a village. It's not easy and not something to do. So we right now are treating young men age 14 to 21. And what we're seeing is just, it's not enough. I mean, we could open probably 10 Serenity Mesas across the state and it wouldn't be enough. And, you know, it's hard to get someone when they're ready for treatment. And so if we don't have the ability to have beds ready, bed space, whether it's inpatient, outpatient, detox, whatever that is, if we don't have resources for folks when they're ready for treatment, we lose them. And you know, we've had wait lists where we've gone and circled back, and when we've had a bed open up, and those folks are not ready anymore, and we miss that window of opportunity. And it's heartbreaking, because you know that when they are ready for treatment, that's when you need to grab them.
And as a commissioner, I do hear the stories from parents who say, you know, when their child was ready for treatment, there was nowhere to go. Mm-hmm. And so I think we all recognize that there's a big gap in the services that are needed in this community. So thank you for your work, and I just want to say, you know, I think a lot of us elected officials really credit you and the work of healing addiction in our community with raising public awareness and bringing this to our attention very early on.
Thank you.
So thank you for that work that you've done. And I want to welcome Rodney McNeese, University Health Sciences Center. So you, University Hospital, on the front lines of this of this challenge, also the Health Sciences Center. So University Hospital really has two roles. Can you talk about the work that you're doing?
Thank you, Commissioner. Yes, and I very much appreciate the opportunity to be involved in this conversation, because I think the HOPE initiative, along with the work that really the county has spearheaded around the new gross receipts tax, having analysis of behavioral health and addiction services in our community, has really helped to focus a lot of the conversation and to get consensus on things that need to be done in the community. I think what the Health Science Center is really focused on are a couple of things. One is related to treatment, and we've had significant resources for addiction treatment in our community for a good while. However, that's still not enough. If you look over time, the last 10 or 15 years globally at the addiction resources available in Bernalillo County, those services really have degraded over time at a community level, and there's lots of reasons why that has happened historically. But I think we really have gone past kind of the tipping point with that, where we've got to begin to reestablish services and have better access to care. Our ASAP program is looking at specifically expanding services for adolescents on an outpatient basis, which is, Jennifer indicated, is a significant issue. It really, if you're a parent, it's extraordinarily difficult to find a resource in this community for your child, and that gets to be a very scary thing. So I think the Health Science Center, working with the county, with other community providers, how do we reestablish that network and really get better access to treatment? The other thing we've seen is through our psychiatric emergency department, the population with that really has shifted somewhat, where we tend to see more folks with addiction issues, especially related to opioid addiction, coming through that service than we did, say, 5 or 6 years ago. So there really has been an uptick, and I think part of that speaks to the fact of the lack of other resources as people end up in the emergency department. The third piece is really around how people get into opiate addiction, and people historically have thought of heroin and kind of the things that go along with that, but a lot of what we see currently is through addiction to prescription pain medications, and that becomes a gateway for people to become addicted to opiates. And so you see populations that traditionally were not necessarily the group you would be seeing for this issue. And I think that also has pushed the age in which folks we are seeing down, where we're seeing more younger people because of the access and the ease to those kind of medications. So our pain clinic is working also very significantly on this issue, and how to better understand the dynamics of opioid addiction, and to work with people on how we manage pain more comprehensively, hopefully in a way that mitigates the risk of that addiction. So those are some of the things that the Health Science Center is working on, and we also, being an educational institution, also think education plays a very significant role that kind of cuts across all of these things. I know there's been, with some of the local discussions, things around more preventive things, education, the use of Narcan, and the availability of Narcan for folks that are experiencing an opioid overdose, and how do we help to foster the availability of that.
Well, thank you. Damon, I want to thank you for your leadership and that of Dr. Paul Roth for the HOPE initiative. I think it recognizes the many facets of the addiction crisis, but really looking at the law enforcement, how law enforcement can partner with the healthcare system and the health education system in taking a more comprehensive approach to this. Can you talk a little bit about some of the other things that you're doing in your office?
Sure. Well, excuse me. First, thank you. Chancellor Roth and the Health Sciences Center has been incredible. And so much of the success of the HOPE initiative is because of them and his leadership. If I could just talk to you about the prevention and education. Yesterday, the FBI and the DEA introduced a documentary that has been made. And we're hoping that educators, counselors, and teachers will go to fbi.gov and look at this documentary. It's called Chasing the Dragon. And then in turn show it to the kids if they feel it's appropriate. The ideal audience for this is high school age kids, but we believe that also middle school children could benefit from this. Basically what this documentary is, it's about 45 minutes. And it's individuals who are addicted or who have suffered as a result of their children being addicted. And it shows the pain that they go through and how this addiction changes their whole life. These people who become addicted, they don't care about their families, they don't care about their friends, they don't care about their job, their school. Everything revolves around this addiction and it ruins them. So again, if educators, counselors, or parents go to fbi.gov, look at this documentary, and if they feel that their families could benefit from it, please take a look at that. Also, if I could just say from some common sense things, if you're prescribed prescription drugs, don't let anybody else take your prescription drugs, and don't ask anybody for their prescription. And if you believe that you have an issue, you're addicted or someone that you care for is addicted, and you have a doctor, be honest with that doctor and let that doctor help you out of this state that you're in.
Thank you, and I'm glad that you mentioned parents viewing this. As a parent, when I saw it, the first thing I wanted to do was go home and show it to my children. I have teenage children, and it was a very moving and striking, I think a very effective film, so I want to thank you and the FBI and DEA for doing that. You know, the New York Times recently had a very interesting, very comprehensive article about how this opioid and heroin addiction crisis is really something that is happening nationally. But they did specifically focus on New Mexico and you know, provided some really good information about just showing over the last 10 years, over the last 15 years, really how this has exploded across the country, but specifically here in New Mexico. Recently, there was a new book that came out that really talked about how did we get there? You know, how did this happen? And Jennifer, I know that you have encouraged all of us to read that.
Right, Dreamland. Yeah, it's called Dreamland. It's written by former LA Times reporter Sam Quinones, and he will actually be coming to Albuquerque in partnership with Healing Addiction in our community, Bernalillo County, UNM Health Sciences, and the U.S. Attorney's Office. So everybody at this table has really worked hard to bring this event to Albuquerque, but Mr. Quinones will be coming on April 11th. To do a community-wide awareness event. And so he'll be doing book signings, there will be a panel of folks, I think some of us are on that panel, discussing the epidemic and what it means, how did we get here? And that's kind of what his book talks about, is how did this happen? You know, and New Mexico is a unique state in all of this, in that we have had heroin in the state for years, and some states are just now experiencing heroin. It's something that we've been dealing with for many, many years. And it's exploded in our state to areas that never even had it touch their lives before. And so he'll be here on April 11th. The event is free. It's at the African American Performing Arts Center on the fairgrounds, the New Mexico State Fairgrounds. 6 o'clock, there'll be information on Healing Addiction in our community's Facebook page and website. And we'll be doing more media events as we get closer to that date.
Well, thank you, and thank you for alerting all of us to Mr. Quinones' book. I have read it, and again, it is a really amazing research effort in sort of tying together both the healthcare component to this and the law enforcement component. And so I really want to welcome everybody to join us for that very important free public event. So that I think that concludes our program. I think the important message is, as Damon said, if you or someone you know needs help, please reach out to your doctor right away. There are resources available. You can also reach out to the Bernalillo County's Metropolitan Assessment and Treatment team. That's our MATS team at 505-468-1550. Again, that's 468-1550. And I want to again thank all of you, not just for being here today, but for also all of the work you're doing in our community to help us all deal with this issue. So I'm Bernalillo County Commissioner Maggie Hart Stebbins. Thank you for joining us for today's edition of Conversations with the Commissioner.